Just like to welcome everyone here today for I think this the second Research on the Run session for our research showcasing our research at Grampians Health. So great to have everyone here. Super excited to hear about the research projects today. And before we start, I'd just like to acknowledge the traditional custodians, traditional owners of country throughout Australia, and recognise their continuing connection to lands, waterways and communities. And we pay our respects to Aboriginal and Torres Strait Islander peoples and to elders past and present. So we have 3 speakers today, and the first presentation is a 20-minute presentation and the second 2 presentations are 5 minutes. We will have time for questions at the end of each presentation. So I am going to just stop sharing and I'll let Vikki get set up for her one. So Vikki Doddamani is going to speak to us today about her work on parents' experience of social connectedness at an infant massage group in regional Victoria. Over to you, Vikki. Vikki, you're just on mute.
Sorry, I'm just checking there. Can you see? Good start. You can see the screen. Wonderful. All right, so thank you, everyone. It is very exciting to work in this space at the Early Parenting Centre. And this presentation is a progress report of the research that I'm currently undertaking. And I'm actually the nurse unit manager at the Grampians Early Parenting Centre. And this is part of my thesis to go towards my master's in perinatal and infant mental health. So alongside this, I'm collaborating with my supervisors, so Dr. Sammy Russell, Dr. Carolyn Bailey and Helena Anlock as well. So I just want to do an acknowledgement to country and pay my respects to all traditional custodians of the land in which we are gathered, children and their families past, present and emerging. Sovereignty has never been ceded, it always was and always will be Aboriginal land. So the background of my research, I worked for many years as a paediatric nurse in specialist community public health nursing, and I am a qualified infant massage educator, also a parent myself. We know that there's challenges in parenting and how we can navigate through this. So I've seen the effects of social isolation and how fractures in an infant-parent relationship can occur. And that's physically, emotionally, developmental deficits can occur with the children as well. So this can result in more pressure on an already overburdened hospital system as parents seek access to services to help with their child. Reflecting on various experiences, the background knowledge that I've got has led to the research. Families, they move away from extended family, results of COVID isolation, social disconnections can occur. The infant-parent relationship is considered a priority at the EPC to provide the early intervention support for parents who are struggling with sleep and settling, with feeding, childhood behaviours in general. So I want you to think for a moment about a depressed baby or a baby who's been shaken. Unfortunately, it's both of those situations I've witnessed, and the effects of stressed, depressed parents, not intentionally causing harm, but did. And both examples identified where social isolation played a part for struggling parents not knowing where to turn. We know that group activities enhance social connectedness, therefore to play a part in helping families and children have more positive outcomes. My research focused on the investigation of parents' experience of social connectedness during the infant massage group, which is normal operations of the EPC that we've commenced. We are social creatures, like the animals here, these meerkats. It takes a village to raise children sometimes, and we all like to look out for each other. So moving on to the aims of my research, it was to explore if social connectedness is achieved through the attendance at an infant massage group. There is no other free publicly funded infant massage group that I've identified throughout our Grampians region. So it also came from a response from key stakeholders. They identified it was a great innovative way to support parents, enhance social connectedness, and it did align with our Grampians Health vision to be innovative in our practice and support patient-centred care. So primary objective was to explore the experience of the connectedness. Secondary objective was to understand the enablers of continued engagement in this group activity. There isn't any funding attached to my research, but just kind of wanted to acknowledge that the project has invested over 148 million towards this new upcoming early parenting centre, which is just fantastic, but nothing related to the research in the funding. So the outcome measures and the findings from this study, we hope to inform practice at the Grampians EPC and identify if the infant massage is a suitable group activity for that social connectedness. Parents' needs for social connectedness will be better understood. So moving on to the literature, done a lot of searching around to see what's out there. What we know is that 1 in 7 women may have postpartum depression and may go untreated, undiagnosed, and suffer in silence due to the stigma still associated with mental illness. 1 in 10 men experience symptoms of postpartum depression as well, and it's a declining physical, social, and emotional health that are contributing factors. A systematic review that I did identified that across the world there was limited data and very few articles that captured the experience of group activities and social connectedness within infant massage groups. There's only 8 papers that I identified that seen the effects of mothers' wellbeing on infants' development. And one paper depicted how an exclusive men's group was able to alter expectations and desires around fatherhood through activities that help them reconstruct their own identities being a father and a new parent. So the gaps in research in regards to the social connectedness was really what I was wanting to start looking at, because it was identified gaps. We know that infant massage is a low budget activity and it does have positive effects on the mother's well-being as well. So to examine the research, I'm using qualitative process and interpretive data to investigate the experience of participants in the massage group. I set up a QR code using the MS forms, and that was available for parents to complete the online survey. I did have a paper form available as well. Got the low risk ethical approval granted in August, so we started in August. And basically participants complete a survey post attendance once it's a 4-week group, so once they've finished their 4 weeks they fill in that form. What we know so far, it is preliminary data. We're still ongoing for a little bit longer. If we look at the 20 participants that have already come along to our infant massage group since we opened, we've only really collected 6 surveys so far, and they've all been completed electronically and nothing in the paper format. We looked at, sorry, lost my train of thought. We do have another 2 groups that are running. One started this week and one starting next week as well. So hopefully this will continue through to November as well, so we can get a little bit more data that comes through. What we do know when we're looking at the demographics of who've completed the surveys so far, 100% of them were mothers. We did have a father attending a group, but he did only come to 1 session. So therefore that he was excluded from the research because of that. Babies between 2 months to 12 months, and 5 out of the 6 it was first time babies for the families as well. But when we did ask how many times a week do people meet socially, 2 responded only once a week, while the majority has stated 3 or 4 times a week. So the findings to date shows lots and lots of positive words indicating that parents experience parents' experience of social connectedness at an infant massage group does have positive outcomes. It's a good experience, good massage techniques, people are learning new skills. It's amazing. People didn't want it to finish. They wanted it to go on for longer than 4 weeks. But the main findings are that they've felt connected, they've felt nurtured, and they've enjoyed coming along to it. So linking to the literature review as well and aligning with the outcome measures that I originally spoke about, we are starting to see themes. So I use Braun and Clark's framework of thematic analysis. One of the particular things here, have you noticed any changes in your emotional health since attending? And I think this really picks up that people who come along to it feel more positive. So 4 out of the 6 had noticed a shift in their emotional health. So the things that we're starting to see is from the positive words that I showed you a minute ago, we've got physical positive reactions that's happening. We've got emotional positive responses, and we've got that social connectedness occurring as well, which I just think is fantastic. People have identified that the social connectedness is at this group. It's really starting to be better understood at the EPC about what we can be doing for families and the benefits of it. There is some limitations. We do have a short time frame for this because it is my master's. So the sample size is quite small at the moment. So hopefully with the other 2 groups, and there's about 4 or 5 in each group. So hopefully we'll start to see some more data coming from that as well. The implications for practice, we all want to see happy, healthy babies, like the picture says here. What we're looking at so far is that we're starting to understand the parents' experience at the group. We know that through the literature review, the importance of the parent-infant relationship to enhance positive mental health and well-being, and that's always going to remain pivotal to us at the EPC. Engagement in the group is positive, outcomes achieved, and demonstrate the need for continued support despite it being underfunded. And an infant massage group activity could be a way to enhance perinatal and infant mental health in the Grampians. So it's filled a gap in services, and we can present this data once it's complete to demonstrate the positive outcomes of the continuation of the group activity and continue for the larger sample. Like I've said before, we do want to see happy, healthy babies. They are our future. They are going to help us, move on in what we do for early intervention and support the life trajectory, I guess, for infants, and hopefully not have the continuation of an overburdened hospital system, which is what we're seeing at the moment. I'm sure there's a massive longitudinal study at some point that will come, but one step at a time. So yeah, any questions? There's probably, maybe I did go on for longer than I thought I was going to. Lots of references. But anybody got any questions? Thank you for listening. I can stop sharing. Oh.
Great presentation, Vikki. Well done.
Thank you.
Really nice and clear, and yeah, great slides. Fantastic work. So if you would like to ask a question, feel free either just to speak up or you can put your hand up. But anyone have a question? So I'm going to kick off, Vikki. So you did say it was the only infant massage centre in the Grampians region.
Yeah.
Are there infant massage centres in other areas of Victoria or other states?
Yeah, so sorry, I might not have made myself clear on that one. So there is lots more early parenting centres, but there's no other publicly funded infant massage group.
Okay.
Yeah.
Oh, okay, so in Victoria?
In the Grampians that I could identify. So there's lots of people running private. Well, there isn't. There's probably about 2 or 3 running infant massage as a private entity, but nothing that's a free group. Yeah.
Okay. All right. Fantastic. A cush one.
Oops. Hi, Vikki. Courtney Mellor is here in the background with me as well. Great presentation. Sorry, missed the first little bit, so you might have covered this off. But I'm just curious, do you think it was the actual massage itself or really the function of the group that improved the outcome for the families that were involved? So group therapy, as we know, you can get some really improved outcomes around mental health, and there's just the massage, like what you're doing in the group as the activity, but in fact it's the social connectedness and the opportunities to have conversations that are achieving the outcome. So it could be a different type of group where you get the same type of outcomes. Have you thought about?
Yeah, absolutely. And that's something, there is a bit of research out there about groups in general. That's part of what I'd said in the literature review. There was only about 8. Nothing specific to infant massage. But yeah, they're interesting topics because I actually think that this could be replicated in other group situations to see, if a group in general creates that social connectedness. We know it does, and that's why the recommendations are out there to run them. Unfortunately, it's probably the first thing I think staff seem to drop when they're just running against the tide of, being able to run a group. It's the first thing that people seem to drop off the radar because they're trying to pick up other things. But yeah, just the crucial time to have that, because it's so important to the parents, even if sometimes it's not high on our agenda. And I do think, oh, sorry, go on.
It's a safe activity. You're coming to a massage group for your baby, which is great. But then you also have the side benefit of improving mental health as well.
Absolutely.
So, it feels safer to say I'm going to a group for a massage for my baby as opposed to I'm really struggling. It's a nice way to get people in.
Yeah, thank you. Yeah.
Any other questions? Oh, it sounds like a lot of fun actually going in with a whole bunch of babies. Maybe not to everybody. And doing massage. So that's got to be a good, good environment.
We run it on a Monday and a Friday morning. The facilitators are amazing. The whole building just goes into this calm zen, seeing the babies leaving. And I think sometimes we've thought, maybe the research survey doesn't get completed because the families are so quick to get out the door, keep that moment of calmness. So, yeah.
Like someone they don't want to take any risk. Yeah, true. And, surveys are notoriously hard to get, good response rates. And I know you tried both online and paper, but so I think your survey rates look about on par with most, but it's just a tricky data collection method, I think.
Yeah. Oh, thank you for that. Yeah, it is hard.
Did someone else have a question? I'm not sure if someone... Thanks so much, Vikki. That's fantastic. Good luck with the rest of the work and writing up your thesis. Oh, Katrina. Oh, Katrina, you're on mute. See if I can mute you.
Is it in the chat?
Sorry, there we go.
Oh, there.
Sorry. I was just wondering, you're talking a lot about the outcomes for the parents. Is there any research or data about the outcomes for the babies pre and post?
Yeah, look, I think there is beginnings of that. There isn't, it was really hard to find a particular questionnaire or assessment tool to use. I was mindful that I didn't want to move into a quantitative pre and post research. There is a couple of assessment tools that could be used for the infants, but it wasn't part of this research.
Yeah, great question. Okay, anybody else? Thanks very much, Vikki. That's fantastic. And
Thank you. Thanks. Thanks all.
Okay, so next up we have Hannah Ryan West, and I think it's a combined project, but I'm not sure who's presenting, and Kerry Davidson. And their project is on the SMSPRO. And Hannah, are you okay to put your slides up?
Give it a go, and I will change it to, there we go. It's just myself presenting slideshow.
Perfect.
Can everyone see that okay?
Yep.
And I will do my best, but I'm definitely not going to promise that it's going to be 5 minutes. I reckon it's going to go a little bit over, but I will whip through. And I will preface that by saying that we have got a fully completed report. There'll probably be gaps in what I do share, but if anyone's interested in that, I'm very happy to share that with anyone. So thanks for giving us the opportunity to present on this. So I am based at Grampians Integrated Cancer Service. We sit in the Brick Building on level 2 and work with cancer-related services across the Grampians region. So this project is now completed. I took it over from a former colleague of mine. So the main aim of this project was to assess the acceptability and feasibility using online-based questionnaires to improve communication between health service staff and community-based cancer patients living in the Grampians region. It did have a secondary objective as well, which was to understand the proportion of patient responses that were considered to be high, medium or low priority as per the response escalation logic, which I will move into. So the product was demonstrated to a few clinical teams across the Grampians region. Initially, it was showcased to 7 different sites. It was shown to about 30 different sites. 7 of those were keen to proceed, but due to COVID-19 pandemic staffing challenges, there were only 3 sites who actually ended up progressing to a full pilot of the project. Across the 3 sites, there was pretty good uptake for patients who were invited to participate, as you can see there, noting that there was quite a low recruitment number for those who were in the prostate cancer site. Reasons for that being that the project did come to a bit of a standstill as the COVID pandemic sort of flux went up and down, and those guys ended up introducing an additional process which kind of ended up becoming a work duplication if they were to proceed. That wasn't really communicated during this stage, so that's the reason for their low recruitment numbers. I will continue to whip through. So just moving into a bit more about the technology and a bit more about what the project actually was. So the trial utilised an external digital platform, which from my readings required quite a lot of investigation in what platforms were available, what we wanted out of the platform, and we ended up landing on one who was called Personified Care. And the reason that they ended up going with that particular company was really good platform usability, safe and secure data storage, and very good customer service and affordability as well, which is obviously quite important. So behind the scenes, the GICS team worked with the different stakeholder groups, so those 3 groups that were mentioned on the previous slide, to design customised questionnaires that would be sent out to their patients. And alongside that, so if you look at this top one here, the patients would get sent out the questions, and then based on their responses, it would be allocated a flag trigger colour, so green, yellow or red, which would then determine whether or not the clinical teams needed to actually make contact with the patients, as you can see here, based on what flags they were assigned. So there was a huge amount of work. Each site had their own customised surveys. Some of the teams decided to have their surveys automated. Others had a few different ones that could be sent out, which could be manually sent out. As you can see here, so red flags generated were those that needed urgently contacting. If a yellow flag was triggered, that was within 5 days, and green flags were basically that there was no action required. So just giving some feedback on part of our secondary objective into what flags were triggered. And I will go into a tiny bit more detail on the red flags, although that was actually over and above what the project was anticipated. But the clinicians were quite interested to see what responses did actually trigger a red flag. So over the course of the project, there were 7,876 patient responses that were screened. And the large majority of those elicited a green flag, meaning that no action was required. which basically was really good feedback, because that then allowed the clinicians certainty of who they did need to contact and who kind of needed contacting urgently. Of the red flags that were raised across the sites, Wimmera Cancer Centre and the McGrath breast care nurses had nearly 50-50, and a very small amount of patients that were with the prostate group had red flags raised. Of the amber flags that were raised, 63% of those were from the Wimmera Cancer Centre, 29% from breast cancer patients, and 8% from prostate patients. Of the McGrath breast care nurses, the main top 3 reasons for red flags being raised for that group were that they were on hormone blocking treatment, that the patients were experiencing difficulties with their normal physical activities, or that they wanted a phone call prior to their next scheduled appointment. Of the patients in the prostate cancer site, main reasons for red flags from those guys were needing help for new or unmanaged concerns about worry, needing help for new or unmanaged concerns about feelings of sadness, or needing help for new or unmanaged concerns to do with their treatment side effects. And from the Wimmera Cancer Centre, who were quite broad in the patients that they included in the study, they had, most of theirs were due to other symptoms. There were really broad range of things. The most common of those other symptoms were bowel-related issues or respiratory issues. And then the other 2 most common red flag issues were nausea and chest pain concerns. Looking into acceptability of the platform, which was one of the one main aims to understand the acceptability of the SMSPRO. I won't chat too much on this, but basically the purple colours is a really positive feedback and the other colours not so much. So you can see that there's lots of purple in there. And we got all this information back from an exit survey. We sent out 79 patient exit surveys and had a completion rate of 51%, which we were pretty happy. The best response rate was from the patients who were part of the breast cancer cohort, and those clinical staff members did let their patients know the importance of completing this, which is why their feedback was quite well compared to some of the other teams. The patient feedback, so 86% of patients found it easy or very easy to use, with participants noting the reasons for that being that the platform was quick and easy to use, easy to navigate, and that the questionnaires were quick and easy to complete. Staff feedback, while there were differing views on the overall usability of SMSPRO from a staff perspective, 43% agreed that it was very easy to use, while others felt that it was easy. There was majority agreement that the inputting of patient details was pretty easy, and that logging into the platform was pretty easy as well. For the few staff members who found it neither easy or difficult, that was mainly to do with them forgetting passwords to get into the system because they didn't use it very regularly. Looking at user experience and how it made the users feel. For most of the patients, you can see there again lots of purple, which is a really good feedback. Patients agreed that it made them feel better cared for and better connected. And regarding whether they'd recommend it to other patients, again, most of them agreed. There was a bit of a gap in this survey in that it was sent out to patients via SMS, so there was no opportunity for open feedback. The staff feedback we did elicit via an actual interview, either in person or via MS Team, and there was opportunity for a bit more open feedback, which was really valuable in understanding how they found it. So you can see that there's a lot more variability in the staff experience. Pretty widely agreed by staff that it was helpful in tracking patient symptoms while they're at home, with 71% of staff agreeing that they would recommend the SMSPRO questionnaire to other cancer providers. Staff were divided in their opinions on whether it helped identify patients needing urgent attention, save them time, or increase their capacity to provide person-centred care. For staff in agreement, there was lots of recurring conversation noting that it allowed them to be more efficient with their time, as it flagged the patients who needed really urgent attention. And by collecting information prior to calling the patients, they could also pre-prepare material, which made their time more efficient. So reflecting on the aim I guess we can say overarching and reflecting back on the feedback, that the platform was really well accepted by both staff and patients. In terms of the feasibility, I think we didn't actually properly answer that, and the reason for that being that there were a few gaps in what we were actually measuring, part of that being the financial viability of this and looking at existing systems and how it could be integrated in. Lessons and challenges, financial implications was a big, I guess, missed opportunity for us to consider. There were a few gaps in the technology that were not fully understood when the project was launched. And other challenges, a big one was the change of principal investigator. So as I mentioned, I took this project over from a former colleague. So there were gaps there in information, how it was stored, which did make things a little hard to proceed with. And I'm sure I've already gone over 5 minutes.
Good job, Hannah. You packed a lot of information in a pretty short time. That's great. Does anyone have any questions? Hannah, what was the driver for the work? Where did the drive, who made the decision to introduce it and why did they do it?
Yeah, it was, I think, initially on a gut instinct of a former colleague of mine that there was gaps, and then they did do some research, and there was quite a lot of research, again, that is in the report, indicating particularly for patients receiving home-based cancer services that using patient-reported outcome measures would enhance that connectivity, and also part of that research also we're saying that patients, we can give them all the information and, if you're worried, contact your healthcare provider, but often they leave it till too late, which can result in an emergency department visit or having to come into the CERT clinic, potential admission, and them going past the point of a quick intervention and needing an admission. So that kind of warranted the research to see if it was viable.
What's happened following the project? Are you still using the SMSPRO?
No, so this again comes back to the financial viability of it. So we funded the external platform, but there was no information that we collected during this study to look at time save or cost save to work out if it's viable moving forwards from a financial perspective, because it's not something that was ever intended that our integrated cancer service would fund, and that would go back to the health service. But basically it was just, I guess, a pilot to see the viability of it. So yes, it's viable, but the financial implications are not fully understood. So to proceed, I think there would need to be another phase 2 looking at different elements. We did look at potentially doing that with the breast care nurses. They found it really useful, but to go back would have required a whole different ethics, lots of amendments to be made, and data we would have had to capture would have had to be done, and it was kind of just not really worth it at that late stage in the project. So a very big learning.
Okay. Anyone else have questions for Hannah? We're going to let you off the hook then, Hannah. Great job. And it's always hard to pick up projects, so well done with that. Yeah, great work. All right. So last but not least, we have Ellie Orr, and Ellie's going to be speaking to us about her project around perceptions of transdisciplinary swallow screening in pulmonary rehab program for people with chronic obstructive pulmonary disease.
Thank you.
Ellie, thank you. Welcome.
It's a bit of a mouthful, isn't it? So I'm just going to share. So that's sharing the PowerPoint.
Yeah, just go to full screen.
Is that? How's that?
Not on full screen, so maybe you might need to share. Have you got more than one screen that you're working off?
I do. This happened to me last time, actually.
Yeah. So you just need to maybe stop sharing and share the other screen where it's coming up full screen.
That's a good
It's always,
idea.
it's always a trick.
Try that one.
No, that's got us. That's got your team screen.
Oh dear. It's unbelievable. Well, it has to be the other one. I know my colleagues will be laughing at me right now.
No, we're not, Ellie. We know which room you're in. We know which page. Your notes page is showing at the moment.
Do you know what? If it's not gonna
Louise, do you have Ellie's presentation?
She does. And if I just go slideshow.
I do, and I can try and share it. Just give me 2 seconds.
How does that look? That didn't make a difference.
We're still on the same one. Do you want to just stop and we'll see if Louise can, she's going to find your one and she can share it maybe. I mean, we can work off that one. So Ellie, if you just stop sharing for a second, then Louise can put up the light.
Sorry, everyone. This happened last time I presented from this computer, so I'll blame the computer, not my tech.
It's really tricky, to see where this.
And luckily, Ash did say send your PowerPoint.
Just waiting for it to open.
Yeah. And it's always a good lesson for all presenters, I think, is to always send a copy of your presentation to somebody who's going to be at the thing in case your computer dies or something happens. It's always a good backup.
It's not opening. Hang on.
Maybe I'll just do it from, you can all read my notes as well.
Yeah, if you just make it big, if you drop your notes down on that page, it'll be almost full screen. So
yeah, that's fine.
Yeah, let's do that then.
How's that? We looking good?
Hasn't come up yet.
Let me see if I can open it from the email, Ellie. I did download it, so I don't know why it's not.
I think Ellie's got it. I think Ellie's got it up, so that's probably close enough. That's probably fine. I think. Let's go with that. Thanks, boys.
All right.
Okay.
So, thank you very much for the opportunity to present my research today. I did this in collaboration with Alicia Sainer, our Allied Health Research Translation Lead, and I'd like to thank her and her incredible support throughout this work. So this work has been done as part of my final dissertation for my Masters of Health Management and Leadership, and I'll also thank my Charles Sturt University supervisors, Sam and Judith, for their wonderful supervisory support. So my name is Ellie and I'm a speech pathologist. I work in the acute inpatients and specialist outpatient programs. I've been with Grampians Health for over 10 years now. But before I get into it, I'll just acknowledge the traditional custodians of the land on which we're all meeting today and pay respect to their elders past, present and emerging, and I extend this to all the traditional custodians of the land on where we're all meeting from today. So I want to give some background to make it make more sense. This is actually a part of what I'm presenting today. It's a part of essentially two projects. The first phase one was a quantitative project, and the second phase, which is what I'm focusing on, was a qualitative project. So to give some background information about the two projects, chronic obstructive pulmonary disease, it's a collective term for a number of subgroups of inflammatory airway diseases. The relationship between COPD and dysphagia is really well known, and literature reports that 17 to 85% of patients with COPD have swallowing difficulties, which we speech pathologists term dysphagia. Of those with dysphagia, 17 to 42% go on to develop an aspiration pneumonia. So early dysphagia diagnosis and management can play a vital role in optimising patient outcomes. And as our population grows and ages, we're placing more and more emphasis on prevention and rehabilitation, be that through education or early identification and management. Pulmonary rehab programs are designed to do exactly that, prevent and rehabilitate clients with COPD. Speech pathology plays a peripheral role through the pulmonary rehab program here at Grampians Health. We provide a one-off education session within the 8-week program. However, we know that education alone is not sufficient in identifying dysphagia. So we felt as a part of this phase 1 and 2 that our PRP here at Grampians Health provides us with an opportunity for a transdisciplinary approach in identification of possible dysphagia without significant changes to practice. So in phase 1, we wanted to investigate the impact of a novel transdisciplinary dysphagia screening questionnaire on referral patterns to speech pathology. And as a secondary objective, we explored waiting times between referral to speech pathology and speech pathology assessment. And this is just an example, or is in fact, our dysphagia screening questionnaire. It contains questions around possible signs and symptoms of dysphagia. It takes less than 5 minutes to administer and requires the participant or the client to provide a binary yes or no response. And a yes response indicates a referral to speech pathology. So this is what our physiotherapists were using in their pulmonary rehab program at the beginning of the 8-week program. So for phase 1, our results found that there was a significant increase in referral patterns to speech pathology following the dysphagia screening questionnaire and a reduction in waiting times to speech pathology assessment. So concluding for phase 1, we found that a transdisciplinary approach to identifying at-risk for dysphagia clients in a PRP significantly increased referrals to speech pathology for more formal assessment, and waiting times to referral reduced. We concluded that then a systematic approach to using a transdisciplinary model was conducive to streamlining processes and improving the potential dysphagia management of people with COPD in the community. However, we didn't, in that phase 1, look at how the clients and the clinicians experience that process and that transdisciplinary model. Enter phase 2. So phase 2 was a single site qualitative study using the same PRP. We developed 2 different types of semi-structured interviews for both clinicians and clients. And the interviews differed because of the differing experiences that each cohort had. For clinicians, we were interested in their experiences practicing outside their usual scope of practice. And for clients, we were interested in their understanding of disciplinarity, if at all, the convenience of the questions or inconvenience, and understanding of the relevance of the questions. We included clinicians who had or were currently working in the PRP and could report on their experience delivering the swallowing screening questions. Clients needed to have a diagnosis of COPD and have participated in the swallowing screening questions. And sample selection ceased once the data demonstrated saturation and no new codes or themes were being revealed. So we collected data by recording each interview via Zoom with the transcription active. And we employed qualitative interpretive methodology drawing on the foundational principles of thematic analysis by Braun and Clark. As the principal investigator, I de-identified and familiarised myself with the transcripts to ensure accuracy against the audio. And once I'd developed some initial codes, all the authors met and agreed on themes. Altogether, we had 12 interviews. We had 4 clinicians, 8 clients. Each participant was given a pseudonym. We had clients who had participated previously in the program and some that this was their first time. And clinicians ranged from rotating grade 1s to program leads and senior clinicians. Analysis from the interviews revealed many numerous codes and 4 main agreed upon themes by the research team. These themes were: 1, dysphagia screening promotes efficiency in directing appropriate care. 2, screening in PRP optimises opportunities for prevention and early intervention of dysphagia consequences. 3, transdisciplinary screening promotes capacity and capability through collaboration. And 4, education is essential for both clinicians and clients. To some of the quotes, there were many that came up. I'll give you a couple for each theme. For theme number 1, about screening questions promoting efficiency and appropriate care using the dysphagia screening questionnaire, for one clinician, Harvey, he said that they're actually quite efficient. They're readily available. Yes, no kind of questions. In terms of cost and resources in doing it, it's extremely minimal, extremely resource efficient. I think the prompt questions are 4 or 5, so fairly efficient, easy questions. And even around efficiency and care, we found the clients hardly noticed or remembered the questions being asked. For example, Christine didn't even remember them being asked. So not much of a blight on their assessment process at all in terms of efficiency. For theme number 2, which was optimising prevention and early intervention, we had quotes such as Jono, a clinician, to reduce the risk, you're not going to eliminate it. It's like coming to PRP is not going to eliminate the risk of going to hospital. But if we can reduce it, that's the goal. You can catch it early, as preventative medicine and treatment prehab is better than rehab. Clients also saw the benefit of prevention, even if it didn't relate to themselves, such as Stuart. Okay, it might not be beneficial to everybody, but if it helps somebody, that's all that matters. If there's 100 people involved in this, you can get 50. That's a bonus, I believe. Theme number 3, transdisciplinarity. For transdisciplinarity, clinicians found it empowering and supporting collaboration between disciplines. Clinician Harvey explained, I think the hidden benefit of that in particular is the education and empowerment of the clinical staff in being able to step beyond what they normally do and being permitted to be able to step outside their more traditional kind of role would be by being guided. If it can be done in a safe way and an effective way by someone that doesn't have that traditional scope, I think the ethical choice is relatively straightforward. If it doesn't have foreseeable risk or adverse events or worse experience for the client, that greatly changes the mindset into implementing new ideas, in particular, if those new ideas are non-traditional. And for the final theme of education, clinicians felt that continuing education was important to sustain the relevance of asking the dysphagia screening questions, and clients had fantastic suggestions for other modes of education to increase their awareness of dysphagia in COPD. So the conclusions from this research in phase 2, we found that transdisciplinary approaches to potential dysphagia identification is feasible and well accepted by clients and clinicians. This approach offers holistic assessment, facilitates appropriate speech pathology referrals, and optimises patient awareness of dysphagia. And phase 2, this study is congruent with the literature around transdisciplinary approaches, and it provides further evidence around such models for outpatient clinical areas. Yep, further research is required as usual, but to continue to build on evidence related to clients and clinicians using transdisciplinary models across a variety of outpatient services. And we need more research just to support our allied health leaders and innovative health services wishing to address the increasing demand and preventative approaches in chronic disease management. Thank you.
Well done, Ellie. That's a great presentation. Huge body of work, obviously. And you know it deeply.
I do.
And you can hear that when you talk about it, which is fantastic. So well done. And then if you want to just stop sharing, we'll just see them. And if anyone has questions, please put up your hand or just call out. Akushala's put into the chat, excellent presentation, Ellie. Hey, so while Akushala's here, and I just caught that last bit in your kind of summary, I guess, Ellie. It said something about allied health managers supporting clinicians to do research. So I'm going to get you to expand on that, and I'm sure that Akushala may have some input upon this.
Well, look, I think, so the comment was that, maybe this research can help support allied health leaders in trying to, change things up a little bit. We're trying to use the resources that we've got, step outside the box, think outside the box. But, the theory is there. The literature is rife with transdisciplinary care being really valuable. It's collaborative, it improves patient outcomes, it's more efficient, all of that. but in practice, it's really quite hard to find where it works, particularly in outpatient settings. But we're growing bigger. Ballarat's getting just smashed with influx of population, but we're older and our chronic disease is just, we feel it now. We're going to feel it in the future in terms of workforce. We need to be thinking about different ways to do things that are efficient, but with the best outcomes for our patients. So when it comes to our allied health leaders, can we use this research to go, hey, let's try it this way. Let's try a transdisciplinary model. What I think through these two projects we've proven was that you can use elements of a transdisciplinary model without having to change practice too much. You can educate, you can give resources, you can provide, empowerment to other disciplines so that you're providing the best care possible for your patients without having to add resources to that and funding needs. So yeah, I just thought that allied health leaders could, slip that under the manager's nose and say, hey, can we try it this way? But we need it in writing. So that's, that's fantastic. What I meant.
Yeah, no, very nice clarification. Kushla.
Yeah, I think Ellie's research, it has been a long process, hasn't it, when we started on this journey? But it really has demonstrated that we've got to the point where you've got 5 really quick questions which staff feel comfortable asking, which have ended up in an MR form, which flag a referral to speech. So we are picking up those people earlier and getting better outcomes. So I think it really demonstrates that it can be done and done easily, and it's reflected in the feedback from the clinicians that yes, it's easy, and yes, I feel comfortable doing it, and yes, we're getting better outcomes for the patients. And I think the importance of prehab versus rehab as well, preventing as much as possible those people landing in hospital. I think the phase 1 study that was done demonstrated that there were so many people who had COPD who'd been through the PRP. Speech pathology didn't get to see them until they had an acute admission with an exacerbation and an aspiration pneumonia. And so there's a lot of data around that, which is reflected in some of Ellie's other research as well. But I think, it's really been a worthwhile process, and it's got huge applications, that transdisciplinary approach, in every single area that we work in. As Ellie said, we've got limited funding. We have to work within the budgetary constraints we have and use the resources that we have to provide holistic care. And especially out in the regions, I've got Courtney here with me now looking at talking about the generalist specialist roles and how can we translate some of this transdisciplinary practice looking at the generalist specialist. So if you're the sole clinician who's doing infant feeding 1 minute, if I look at the speech pathology scope, you're seeing babies with infant feeding difficulties right through to end-of-life care across every area, but you're the one speech pathologist. What do you do? And then maybe there's not a physio who can help you out, or an OT, or a specialist in infant feeding. So I think, great work, Ellie. I'm behind you.
Thanks, Kush. Yeah,
all the time. Sorry, I should have put my face up. Yeah, well done.
Yeah, fantastic. And I know you've been well supported, Ellie, through your management. And I guess maybe opportunities to share it with the broader allied health team so that they see the way that you've managed to collaborate with physio as well, and other ways to get that message out. For trying to get the transdisciplinary nature.
We probably haven't thought about that yet. I only handed my dissertation in last week, so I'll start working on. I think we've got some great starts with our relationship with the outpatient programs over at Queen Elizabeth, and I think we can only go forward from here. It's really exciting. So
fantastic. Yeah, and I think you're building those relationships. It's key to getting that change. So well done getting practice change. No mean feat to do that. So well done.
Yeah, thanks, Anna.
Anyone else with questions or comments? Oh. Well, just want to thank our 3 presenters for all the effort they put into and the great work that they're doing to help improve, care for our patients. Really good to see people online today. And just a reminder, the next session is on Thursday at 12:30, and there'll be another 3 presentations from clinicians. So thank you for coming along.